Hello, everyone, and welcome to McGill Cares webcast series supporting family and informal caregivers. I'm Claire Webster, a former caregiver, certified dementia care consultant, and founder of McGill University's Dementia Education Program. I work with a dynamic team of leading healthcare professionals to oversee the program, who include Dr. José Moret from the Division of Geriatric Medicine and Dr. Serge Gauthier, Professor Emeritus, formerly of the McGill University Research Center for Studies in Aging. McGill Cares is supported by the Amelia Saputo Community Outreach for Dementia Care. The McGill University Dementia Education Program offers a comprehensive range of free resources to educate and support persons living with dementia, family and informal caregivers, healthcare professionals, medical students, and the public at large. One of our most important resources is our Dementia Companion Guide, which can be downloaded for free. Printed copies are also available on Amazon, or if you're in Quebec, throughout the MUHC hospital system. And it is also available in 14 languages. So you can download the various languages off of our website, which is extremely important. We've also recently launched a free online education course designed to educate and support caregivers to people living with dementia. It's also very useful for healthcare professionals. And the content consists of 10 self-guided modules that the learner can go through at their own pace. So today I'm very excited to have a very meaningful webcast. The title is From Survivor to Leader, A Journey of Resilience and Advocacy. My guest is Laurel Gillespie. She is the Chief Executive Officer of the Canadian Hospice Palliative Care Association. Her journey into this field was inspired by her own health challenges, which motivated her to work to enhance supports for those living with a life-limiting illness. Since assuming leadership in 2021, Ms. Gillespie has championed dignified end-of-life care standards across Canada through partnerships, advocacy, and education, and she currently serves on the boards of the Worldwide Hospice Palliative Care Alliance and the Health Charities Coalition of Canada. And since today is April 16th, which is the National Advanced Care Planning, I thought that it would be very pertinent to invite Ms. Gillespie to share her journey of resilience. And, I really admire women that have taken their personal journey and really have just turned it around to help others. So welcome to McGill Cares.
Thank you so much, Claire, for such a warm welcome. And I hope out of today that people come away from this with just a bit of a better understanding of the realities of being sick and a caregiver, and know that we all have struggles that we have to overcome through life, but caregiving is going to play a big role in all of our lives in the future, days, years to come.
So just tell us about yourself. Let's begin.
So I'm really, this is it. This is what you get. I grew up in Atlantic Canada in the Maritimes originally, and I'm the youngest of 8 children. A lot of nurses, a couple of doctors in my family. So taking care of others and being compassionate was just part of my upbringing and part of what makes me who I am today. So I grew up in New Brunswick, and I left to go to Halifax to go to school a long time ago now. But I've lived in 5 provinces and even out of the country. So I've experienced the US health system, and I've experienced here. So I took on this role. I started with CHPCA, which is the Canadian Hospice Palliative Care Association, in 2019, and was fortunately entrusted by the board to become the inaugural CEO of the organization.
So it was really your personal journey, as a cancer survivor that led you to this work. I mean, what were you doing before this, just to begin? Like, did you have because I know myself, when I talk about doing the work that I've been doing for almost 20 years, if somebody would have said to me 20 years ago, Claire, you're going to become a dementia educator, I would have said, like, what? Like, it was so in a whole other field. So what were you doing before?
What did I do before this? So many different things, but at the time of my cancer diagnosis, I was dabbling a little bit in politics. I ran against Pierre Poilievre in the Nepean Carleton riding, different last name back then. But the reason why I did that was I was trying to run my own little consulting company from my unfinished basement. It was freezing down there, so that I could bring in income to help support my family. I was raising a son on the autism spectrum who has a twin sister. She had extremely, she had really good ADHD, a very creative kid. And then I had a younger one, 3 years younger than they were. I was a military wife, no family in Ottawa. And when my twins were 9, my youngest was 6, I was diagnosed with what is known as triple negative breast cancer, which doesn't have a great prognosis. And I was very, very sick, given a 20% chance of making it for 5 years. And I was like, hold the phone. No, my girls will be fine. They're not going to wear black nylons with white shoes, and they'll wear a camisole. My son, I'm not finished. I can't die. You do what you have to do. Anyhow, that was it's coming up on 18 years. So I am extremely grateful for the care that I received, and being blessed enough to be in this great city of Ottawa, where I had exceptional care right from the surgeon to my radiation oncologist. So I had to go through a double mastectomy, grueling chemotherapy, and then radiation, and then recovery. And my life was changed after that point.
But how, what led you to get through such an ordeal? Because I mean, I can't imagine having 3 young kids and having this very dark prognosis, right? I mean, what was your mental
Yeah.
state at the time? How were you?
My former partner, life partner, my husband, he was 12 years older than I was, and we always thought, well, something would happen to him first, right? It was like, it turned my world upside down. Now, something that I was also doing, and this is where I come in as a caregiver. So not only a caregiver to trying to raise children who had exceptionalities, don't really like to call them disabilities. They were exceptional to the rule. Didn't mean they weren't smart. And I, I had my mother-in-law who lived with us, and we were very fortunate to have built a house specifically for accommodating her on the main floor should she end up in a wheelchair one day. We went into this with the long term, and she lived with us for 6.5 years. And the only time that she wasn't with us was a couple of times when I had to put her in short-term respite at a nursing home when I was going through my own cancer treatments. And then when she finally passed away, she died in hospital, and she was only there for 5 days. The only way that I was able to do that, Claire, and this is very concerning for me and part of what I advocate for, is there's no way that I could have taken care of myself, taking care of my mother-in-law, taking care of my family without help from my siblings that would fly in. Occasionally, my mom and dad would come and help out. But really what got me into this was after my very first chemotherapy appointment, I was hospitalized. My immune system crashed. I was neutropenia. There's a name for it, febrile neutropenia. So I had to be put in isolation because I had no immune system at all, and with 3 young kids and couldn't see them. And it was during that hospital stay, the first one, that I realized, like, ooh, I don't want to die at home. I don't want the kids to have to live in the house where their mother died. What am I going to do with my mother-in-law? Okay, that's a whole other thing. But if something's going to happen to me, what is this going to look like? Well, I don't want to be in a hospital room by myself either. And I didn't know what hospice was or palliative care, palliative approach to care was. So I thought, well, I'll just rent the presidential suite at the chateau and hire a private nurse and get some really nice champagne and good dark chocolate. That's how I'm going to go. I had no idea. until I found out about what this service was that was being offered. I tell you, if it wasn't for the two PSWs, and this is where I get concerned because of cutbacks and shortages of hours and not enough people to go around to help everyone, is two PSWs come into my home Monday to Friday, 8 to noon. And that was a savings grace for me. It allowed us to keep me out of hospital by having help from my mother-in-law to just tend to her needs. So she did have dementia. She started having successive small strokes, and then eventually she died from a stroke. So it was kind of up and down for her all over the place, but very little support. And somehow you just get through it. And my children, I think, were really the motivating factor for me because I knew my job wasn't done yet. And
So when you're
through the
so
graces and powers
PSW,
of whatever, I'm still here.
so
So what good
PSW
can I
for
do to
the
give back now?
so PSW for our viewers means personal support worker. And were the personal support workers from the public system, or did you have to hire private personal support workers?
They were from the public system, and I still keep in touch with them today. They became part of my family after 6.5 years. Yeah, and without them, I likely would not be here.
So
And
one of
that
the
scares me. It scares me because I know things have changed and I know our circumstances were a bit different, not having the family support around, being posted here with the military. So my husband was a naval officer. So there was multiple things at play, but those PSWs made all the difference. They really did make all the difference.
That's part of, when we talk about the challenges of the healthcare system, I mean, like for example, now in Quebec, for people to access what we call the CLSCs, first of
Mhm.
all, like you said, you didn't even know that palliative care existed. And, a lot of people still don't even know that you can have home care support, but there's a process, right? So there's, you need to have the letter from the doctor requesting that the CLSC get in touch with you. And then our healthcare system is so overwhelmed, and it could take weeks or months before families are getting an assessment of their needs. And then in Quebec we have what we call the chèque d'emploi service, where people could get up to 22 hours a week of care, but people don't know, right? And like you said, like people don't know that these services are available to them.
And it actually was through the cancer program and the psychology, the psychosocial program. Pardon me, my goodness, words today. It was through the psychosocial program at the cancer center that directed me to, there's some help that you can get to facilitate, and the geriatric unit at the Civic Hospital here in Ottawa too were part of facilitating help for me within the home. Paradoxically, though, fast forward to just at the same time that COVID hit, my current partner, Sean, moved his mom from Nova Scotia to the Ottawa National Capital Region. And he did live in Wakefield at that time. It was an entirely different experience, but I've been through that process with the CCCLE, I think it is. And it was great, but it was too little too late. Like it took really long time to get that palliative approach to care. And it was like once a week. It didn't compare at all. But again, that's also, a big from 2009, so like 11-year time difference. But I could see and feel the difference in healthcare service delivery and supporting those who are caregiving, while at the same time taking over a national organization as the newcomer. It was just crazy, and COVID, it was just insane. But one thing that really helped me in that piece of the caregiving journey is my mother-in-law did not have an advanced care plan because I didn't know what that was. But with my partner's mom, more recently, we were able to do an advanced care plan with her and what her wishes and her values were. And the two experiences were like night and day. Night and day.
Before we jump into the advanced care plan, there's a question I have to ask because, I mean, you and I met briefly in Ottawa a few months ago, but I too have 3 children. I have an ex-husband. I have had significant personal health issues my entire life, plus being a caregiver. And we reach this, there's a couple of years that it is just like, it is crazy, right? It's messy. And I didn't cope well. I was watching my mother unravel, my children were watching me unravel, and fortunately I have a phenomenal second husband who's been married for 25 years. But boy, all of that, my own personal journey with my health and caregiving, took a big toll on the family. It really, really did, and on my youngest daughter especially. And I suffered a tremendous burnout. How did that all impact you? How did it impact you and your family, what you've lived through? Because you can't, sometimes I sit around with, people talking with them, and there are some women who say, "Oh, my life is great, my life is great," but it's not possible. Like, there's an impact, right? So how did it impact you?
Yeah, there are so many parallels. We'll have to go for coffee sometime. But yeah, oh my goodness. How did it impact me? I guess realizing that no matter what you try to do as a caregiver, as a mother, as a sister, as a daughter-in-law, there's only so much you can do, and there's a price to be paid for doing that. It's either a financial cost if you're fortunate enough to hire outside help, or you do it, and the cost of that is your own health. And I don't know if you would agree that, you're the last one to be taken care of, right?
100%.
You come last, and it's just this mind shift. And I think partly it's nature, nature and nurture. Like it's just ingrained. It's in our DNA to be that way and to always put the needs of others first. I'm still working on that process because I think it sticks with you a long time until you can start creating some of those boundaries to protect yourself. But often you do end up in a situation where you just are so depleted emotionally, physically, spiritually, and you just have to say, like, what gives? And you compartmentalize, right? You tuck it in this little box, and you tuck that in this little box. And I think for me, when I was sick and with my mother-in-law still living, I had shut my company down and I didn't look back. And thought, like, and I was in a fortunate enough circumstance that I could do that. But I took the time to get myself back into a place where I was ready and able to take it on again. So if that was kind of like a burnout, I suspect it was. So I took the time that it needed to empty some of those compartmentalized things that I'll deal with that later, and I'll take care of my own needs later. That's in there. Oh yeah, I'd like to go for a bike ride. Yeah, well, not today. So I'll tuck that away. And it takes a lot of courage, I think, for women to step out and say, you know what, it's okay to not be okay, because we're trying to juggle all these things. And to recognize and give yourself enough grace that not everything's going to be perfect, but we do the best that we can. And how did I get through that? Trying to eat well, trying to spend quality time with my family, and start living again, and seeing the beauty, the small things in life that bring a lot of joy to you, and embracing that. I think that's part of having that healthy, mindful attitude of just being present.
I remember working with a psychologist who helped me get through my burnout period. And I remember her looking at me and saying, "Claire, you're not living, you're just existing," right? And it was, right. And it's like, when you're going through so many challenges, it's like you're at a soldier at war. It's like what is around the corner, right? And I was diagnosed with post-traumatic stress disorder. I call it post-traumatic caregiver disorder. But so, I want to lead to the next question is, so for me, what motivated me to do the work that I'm doing today came from anger. Okay, I stayed in anger throughout most of my journey. I was so angry at the healthcare system. I was so angry, like, how come we're not educated as caregivers? How could we navigate all of these illnesses, not only dementia, but I had I have heart issues. How come I wasn't properly educated, right? And I guess I converted the anger into a positive way, right? But what propelled you to decide, okay, now I'm going to go and do the work that I'm doing? What was the defining moment?
That defining moment for me was in actuality, not having a very supportive partner, life partner. And subsequently, my illness really literally ripped my family apart. It was really terrible divorce, but I was no longer perfect anymore. Um, yeah, and the defining moment for me was it's my time. I was married at 22 to someone 12 years older, didn't get to finish my university undergraduate degree, was moving all over the place. So I decided to go back to school at 45. And I did my master's of business admin and my certified healthcare executive programming through the Canadian College of Health Leaders. But when I was studying marketing, I wanted to learn how to market advanced care planning because I started doing some research a little couple of years previous to this, and I found this at Speak Up program, advanced care planning. And I was like, what is this all about? Wow, this is really helpful. And I had to ask permission from my professor to be approved for this research paper and said, I want to market advanced care planning. And he said, no, at the 10 different jurisdictions, too complicated. And he said, I don't recommend it. Find something else to write your paper on. And I did it anyway. I chose advanced care planning and I did really well with that paper, but I had like ideas of taking your health card, if that's just a health card, and putting a QR code on it, and it would have anything from your medical directives or like DNRs, which is different from advanced care planning. But what's your blood type? What medications are you on? And we could be control of that content in a secured way. And people thought I was crazy. I was like, no, that's not going to work. And I said, but if I put it on our driver's licenses and our health cards, which what we usually have, both, but some only one, it's instant, absolute, quick access to the pertinent information that you might need at a time of an emergency. And the advanced care plan could be housed there. So that was the premise. And it was like, okay, now what can I do with this? Because it really excited me, not from just the marketing perspective, but how important and then living through having been a caregiver with an individual who didn't have an advanced care plan and then one who did have an advanced care plan. I can't even begin to tell you how much less stressful it was, how less, just less stressful. There's less worrying. And you knew to what extent that person would want to go to. And I give the lived example of, we had discussions about dialysis. What if it comes kidneys aren't doing so well, but doctor's recommending dialysis. Well, I'll try it. But if I try it and I don't like it, then I don't want any more of it. Very clear. Let's update your advanced care plan. And that's exactly what happened. She tried dialysis and said, no, this is not for me. And she went on to have a palliative approach to care instituted, and we took the best care that we could of her at home. But during COVID, she was in the hospital, out of the hospital, and we couldn't see her. Anyhow, it was just a far more peaceful, less stressful experience, knowing that we were honoring and respecting her wishes so that she could have the dignity that she needed and have a good death.
So when you hear the word advanced care planning, I think a lot of people think automatically, oh, that's for people that are in later stages of their life. They're in their 70s and 80s. It's only when you have a terminal illness you should start thinking about it, but it's not. So at what age should people begin thinking about advanced care planning, and what would be some key elements? Like, what is the key information that people should have as part of an advanced care plan?
It's a process, and that it's meant to, what we're trying to do with this is normalize it so that people see this as an additional way working with the healthcare system. Because we rely, I believe, far too heavily on the healthcare system. You give them that magic card and everything's supposed to get better. Mm-hmm. You know, all the stresses on the inside of how things work. I appreciate that. If an individual participates in the advanced care planning, it's a way for them to reflect about what are the things that matter to them most. What is it that I would desire for myself at my own dying process? Because there's the dying process, which is, if you're diagnosed with a terminal illness, you know that you're going to have a shortened life expectancy. The death part is like that one, it's literally your last breath, but it's that leading up time, the palliative approach. It's not the hospice phase, but that palliative approach to care. It's really a way of an individual making sure you've expressed or conveyed to another individual or individuals, doesn't have to be just one person, of what are the things that really matter to you. And it doesn't have to be, really heavy and serious all the time. My supportive decision maker is my youngest daughter, Georgia. And, I'll update her if some things change because it's a life planning process, right? If you sell a house, you get divorced, you remarry, you have babies, you go back to school, like your life changes, and that could be reflective of the ages and stages. So I'll use the example, menopause. I'm like, Georgia, if something happens and I'm not able to speak for myself, please make sure when you come to visit me wherever I am that you always have a pair of tweezers. And you can just make sure I don't have any little strays. I know, right?
Yeah.
We giggle about it, but that's important to me. It might not be important to me 20 years from now, but today it's important to me. So that's an example of where I know that seems really frivolous and kind of vain, but you'd be surprised at the number of women that go, oh yeah, and maybe even get somebody to come in to wax my legs. I don't know.
Yeah.
But it doesn't have to be all about the serious things. But you start about thinking about what's important to you, what gets you out of bed in the morning, what are the things, even the small things, what brings you joy? How do you deal with pain? What is the first thing you do when you are in pain? What brings you comfort? What are the things, are there certain things that you would want around you to make you feel more at peace? Are there things you might like to do before you get so ill that you're not able to? I think the one thing with this question, and I can talk a lot, and I certainly can talk about this all day, is that it's never too early to start this process. So I say, like 16, you're responsible enough to get behind the wheel of a car. I think you're responsible enough to decide what would you want to have happen if you were in a terrible accident, right? Kids can donate their organs at 16. Why can't they do advanced care planning? Roll it out when they get their driver's license. Here's your advanced care plan. Sign up for it. Do it, right? Just offer it. Don't mandate it, but offer it. I can tell you from my experience being a caregiver at the same time, and I like to say now I'm a veteran caregiver. I'm not currently, but I'm a veteran caregiver, got lots of experience. But the time for you to, when you're thinking about advanced care planning and you're actually starting to do one, the time to do that, it's not ideal to do it when you've received a new diagnosis. I don't care what diagnosis it is, when you have a significant change in your health, that's a crisis. That's a health crisis. And so many things are going on in our minds. We don't know what to tell family, what to tell friends. We're not really sure of prognoses, how things are going to go, what interventions are available. It's scary. And your mind is in a million other places. And by that point, you're so compartmentalized out, there is no more room to put stuff. So ideally, it's not too late to do it then. It's just that much more difficult and harder because you're having to face potentially your own dying process. But what does that look like to you as an individual? And people say, oh, but it's so hard. I think one of the hardest steps is deciding who that person is that you would want to have speak on your behalf or convey what is important to you and what you value. I think, sorry, I'm just getting over a bad cold. I think one of the important things to reflect on is when considering who would I ask, it's not always the natural life partner or bestie. It could be a neighbor, it could be anybody. But somebody that you trust and that would honor your wishes, I think is important. So in framing it that way, if I asked you and said, Claire, something really terrible happened to you, who are the first 3 people that you're going to call for help? Who would you reach out to? Who are those people, your go-tos that have your back? And I think from that is a good person to have that conversation or to start having conversations with. And if it's the flip side, if it's not for you and say it's for a parent right now, a lot of us a lot of people are dealing with having to be the caregivers and sandwich generations as well, which you and I both experienced while dealing with our own health. Now I'm losing my train of thought. There we go. Isn't this
That's the
fun?
menopause brain.
No, the advanced care planning piece. It's one of those three people. It's easier of who you would call an emergency, but the flip side of that, if you're trying to encourage someone to start having these conversations, i.e. a parent, driving in a car is a great place to start it. If you ever have an opportunity to take them to a medical appointment or even just out for a coffee, you're in the car, one of you is driving, you're both looking forward. You don't have to face look at each other, but bring it up. Hey, I heard about so-and-so, they experienced this. Didn't sound like it went so well. Like, what would you want to do in that situation? You kind of just crack the door open just a little bit to see how they respond. And then you can build on that conversation. And they usually open right up and say like, oh, well, I don't know, I haven't really thought it, but I think I'd like to have, I don't think I'd like that. Or it at least gets them thinking about themselves in that kind of context. How would you, and so I think it is difficult to have these conversations, but once they're started, it goes pretty smoothly and it just makes such a difference to the caregiver, to the patient.
You're making me think how important it is then to just I guess take a pencil and a piece of paper and really write down what is important to me, and then put it in an envelope. And then, like you said, who would those be? Who would I appoint in terms of the people close to me to make sure that my wishes are fulfilled? And almost put this envelope somewhere and say, okay, in the event something happens, please go to this envelope because I've written down, right? And I guess it doesn't have to be as formalized as a will, right? It's really just something saying that, okay.
We have lots of brand new resources.
Yeah.
This is my planning guide. This is quite long. It was done that way by intention. This is one of the most advanced, for an advanced care planning book, it's one of the most advanced documents out there today that is fully accessible in terms of all the guidelines of easy to read language, the spacing, the colors. So this particular project was meant to design these materials to meet the needs of persons with disabilities. And we've succeeded with that. We cannot keep these in stock. They're free. You can order them from our website. So this is like the granddaddy of them all.
We are now putting on the screen how we can access that advanced care guide, correct?
Exactly. Well, yeah, the website is there. We also have a new one. It's a mini guide. So it's a shorter format. So if you're not new to the process of advanced care planning, it's a shortened version of it. But there's all kinds of prompts and questions that get you to start thinking about things you may not have ever thought of before. Like if I'm, how do I deal with pain? Like I want quiet. I want this is my go-to relief. I need soft music. That's an opportunity for you to put all of those things in there.
So before, Laurel, you tell us all about the great resources that the Canadian Hospice Palliative Care Association offers, I believe that you have a short video to show us, correct?
I do, yeah. And that video is about, helping people to decide who you would choose as a supported decision maker and kind of walk you through what that might look like with making a list of, maybe if this person would make a grant, and then you're like, so it's kind of it's just a quick little video to show you that it can be a little bit difficult to get started and when you're choosing them. But I always say, if you're in an emergency, who are your 3 peeps that you're going to call? Chances are it's one of those 3 peeps that would end up being your supportive decision maker.
So let's watch the video.
Be your healthcare proxy? Like if you need someone to tell the doctor what to? I just go with whatever the doctors say. I wouldn't want to bother them. They're so busy. Doctors know best, right?
Be your healthcare proxy? Sure, I'd be happy to if I'm in town. Check out my Instagram pics from Peru. Wish you were here.
Oh, I could never let you go. I can't even throw a plant away. As long as it's got one little green leaf. I'd be like, can't we upload her to the cloud?
Well, heck yeah! I've given this a lot of thought. Let me tell you what decisions you're best off going with. You never let them resuscitate you. And if they even try to hook you up to one of those breathing machines, never! I got this! I totally got this!
How can you even talk about this? I can't, okay? I just can't. Mom, it's not like you're gonna die. No, I can't talk right now.
Oh wait, did I show you that meme from iFunny? The cat and the dishwasher? Oh my gosh, okay, so the cat's like, bleh. And then he's like, wah! Oh wait, sorry, what?
Well, hon, you and I have been through so much together. Here's what we'll do. We'll sit down, we'll get a cup of coffee, and you tell me what matters to you.
Well, it wouldn't be easy. I mean, I'd be sad, but I'd have your back.
I remember when we went through this with Mom, we really spoke for her. So I think I can do that for you. Let's talk about what you would want.
Laurel, please tell us about all the incredible free resources that are available from your organization.
Oh my goodness. How much time do you have? We do have a lot of resources. The current resources that are most up to date are the advanced care planning resources. So everything from the mini guide, there's activity books, there's workshop in a box if you wanted to host something in your community. We have a new video that's about to be released. Advanced Care Planning Day, April 16th. We have a 30-day challenge of like do something each day, and it helps you work more towards you completing an advanced care plan. But aside from the advanced care planning, we're launching a program. It's a little bit different called Last Aid. We're the 23rd country to offer this. Last Aid is a 4-module program. That's the facilitator is one's a physician or a nurse. The other is a person with lived experience in caregiving. And it's really, if you think about basic first aid, how to triage a cut, to put on a tourniquet, it's like that, but it's for end of life. What is it like as a caregiver, what to expect? And the feelings, the anticipatory grief, like there's grief, there's medical stuff, and I was like, oh, well, this would have been great. Because even, if I consider myself to be a fairly astute person, but if I have a difficult time and you have a difficult time, Claire, like navigating the systems and not knowing what's available, wow, well, people maybe who don't have the same level of supports around them, or they're very isolated, how are they navigating? It's so complex and convoluted. So we have a lot. So we're launching the Last Aid program, and it's next to free to attend. We're trying to get it to be free, but we haven't been able to get funding to do that. So it's about $35. So we're really excited about that because I think it'll make a big change. The caregiver guide that we produce with the Order of St. Lazarus in Canada, that's being updated, and Honor Horizon is updating our volunteer training program. So we do a little bit of everything, not just the advanced care planning, but if you look at those websites that'll be provided, as you can see them there in this presentation. And always, please feel free to reach out if you have any questions. Additionally, on our CHPCA website, we have a resources portal that you can pump in like where you're located in Canada, and it will come up with a list of all of the supports and resources that are available in your area.
Oh, that's amazing.
So that's very helpful as well. So, and that's on the CHPCA main website.
So one last question. So what advice would you offer either patients or caregivers who are just starting their journey? Is there anything that you would have done differently?
For myself or
Yes.
for others?
No,
For
for
myself.
yourself. Yeah.
Something that I would have done differently. Well, I wish that I would have known that these things had existed. I think it would have made it a lot easier, and I would have reduced the hardships. It may have kept me healthier. I don't know that there's anything that I would have done differently, Claire, because I wouldn't be here if I hadn't had to go through what I went through and then be hired as the director of advanced care planning in 2019 and then segue into this role. I'm just so extremely passionate about this. And when you have some little bit of control over your healthcare and what your needs and desires and values are, and you have a way to convey that to your medical team, to your people that are in your circle of care, to me, that's everything. So if I could do anything different, and I'm trying to do it now, is to encourage everybody to have an advanced care plan done, share it with your families, friends, whomever is in your comfort zone of who you would want to share that with, and talk to your doctors about it and say, I have an advanced care plan. So they're aware, and don't be shy to talk about it. And no two people's advanced care plan is going to look the same. So I don't know that I would have done anything different. I wish that things would have been there to make it easier. But this is why it's incredibly important to me in the work that I'm currently doing to encourage all Canadians that if you're diagnosed with a terminal illness, you're diagnosed with anything that's going to reduce in your life expectancy, which is basically any non-communicable disease is going to shorten your lifespan in one way or another, is to think about what's important to you. Document it, save it, revisit it when there's a change, but understand that there's hope and that palliative care doesn't mean death. Palliative care is like, you could say it like that dying, there's dying and death. We always say death and dying, like it's some, ooh, death and dying. It's like, no, you're getting to the, if your palliative approach is embedded, that can happen right from the time of diagnosis and introduce you to music therapy, art therapy, inpatient day programs, to be around other people who are maybe struggling with same feelings and thoughts that you're going through. It's a bit of a support network, but it's also hope. And it's also about living your best life ever while you're alive. It's not about that death piece. It's about the hope and what's important to you and how do we make sure that you're living your best life while you're here. Isn't that what it's all about? Finding that joy, right? So for other people who are newly diagnosed, there's still hope. Talk about these things. Encourage your families to talk about them and your friends and neighbors.
Well, thank you so much for sharing your unbelievable story of resilience. And honestly, congratulations for the amazing work that the Canadian Hospice Palliative Care Association is doing. I am a huge advocate for education, and really it's about being educated and informed, to be one step ahead at all times, whether that be advocating for another person or for ourselves. But really, thank you so much for taking the time to be with us today.
You're very welcome. Thank you so much, Claire. A pleasure to be here with you today.
So this webcast is an initiative of the McGill University Dementia Education Program, which is funded by private donations. If you would like to make a contribution to our program, please visit our website at mcgill.ca/dementia. And if you would like to join our mailing list to be notified about upcoming episodes of McGill Cares, as well as other important programs and resources, all free, of course, from our program, you could either sign up on our website or email us at dementia@mcgill.ca. Thank you for watching.